एक्चुअली जो है ना, जो ब्रिटिश फोर्सेस रहती थी, तो उनके जो रॉयल आर्टिलरी और ये जो लोग थे ना, तो उनके वो रेड कोट्स होते, तो हम लोग उनको जो लोकल हम पॉपुलेशन थी वो उनको लाल कुर्ती कहते थे. That's how they used to stay there. So you'll find lal kurti in every camp.
Every cantonment.
Every camp.
Really?
Yes.
Actually, there was a film in India, Mangal Pandey. उन्होंने इसमें इस चीज को जो है ना वो किया था लाल.
तो आप हर जगह हर कैंट में दो चीजें जरूर मिलेंगी, एक लाल कुर्ती मिलेगी और एक आरे बाजार मिलेगी.
Royal Artillery Bazaar. I said that is Royal Artillery Bazaar. So that is Royal Artillery Bazaar.
ये इन्फेंटेरियम थे और वो आर्टिलरी थी. तो ये दो चीजें आपको हर जगह मिलेगी.
इंडी में तो वो एंग्लो इंडियन कम्युनिटी की रहती है अभी.
हाँ, रहती है. अच्छा, मैं बड़ी दफा ना ये जब ये कहते हैं ये CMH का कंबाइंड मिलिट्री हॉस्पिटल, मैंने कहा यार ये कंबाइंड का ये मतलब नहीं है कि इसमें फला भी है, फला भी है, फला भी है. ये कंबाइंड इसलिए है कि उस वक्त दो किस्म की फोर्सेस थी, एक रॉयल फोर्स थी और एक इंडियन फोर्स थी. तो दो किस्म के हॉस्पिटल थे. एक इंडियंस का अस्पताल था, एक रॉयल्स के लिए हॉस्पिटल था.
That's a very
So then जब पार्टीशन हुआ तो they combined the two and made it combined military hospital.
So ये तो very नई information है वैसे जो है ना.
I thought it's multidisciplinary.
That is right, that it is. But
I thought something to do with tertiary care or something.
There are multidisciplinary hospitals, but actually it is combination of those two hospitals. So interesting होती हैं जो facts and figures होती हैं चीजें.
I think we can start now because already we are 5 minutes late. So first of all, I thank you all my panelists and chief guest Dr. Nigar Johar. And this seminar is by SDPI on the day of on the International Health Day, which is celebrated every year on 7th April. And this year it's 7th April under different themes. And this year the theme is Health for All. And we all know that the human resource for health is one of the most important building block of health. And without their contribution at all levels, from the at the hospital, at the basic employee of the hospital or the health system, towards the highest level, it's very important to their contribution is very important. So let me just brief about SDPI, some few facts about the SDPI. SDPI is a leadership. SDPI's leadership and team has always responded timely to engage the policy community for effective and implementable policy recommendations in many sectors and positively taken by the government. A recent example is SDPI response to COVID-19 in 2020 by establishing a dedicated Center for Health Policy and Innovation, and responded to SDPI responded to the policy needs and political engagement for the better outcomes of the interventions done for the COVID-19. We have been working in universal health coverage, social health protection, food safety, public-private partnership, cancer awareness, and very important session in Sustainable Development Policy Conference this year in December was on rare diseases in Pakistan and its management. And recently finished study on the health impact of the air pollution in Islamabad is also done by SDPI, Center for Health Policy and Innovation. Health system resilience and the climate change is also an area of focus for for which many activities are going on. These days, as far as health is concerned, universal health coverage is considered a way to provide the health for all, and primary health care is the mainstay for this. Health for all cannot be attained without introducing a resilient health system, having an inclusive approach. HRH is human resource for health is very important building block, as I said earlier, in health system, along with the health infrastructure, which was most affected during the floods, health financing, medicines, and vaccine. In Pakistan, human resource for health is central, especially frontline workers, as seen in the COVID-19 pandemic and the floods in 2020. As a globally, if we see, the 70% of the health workforce consists of the women, 80% in nursing and 90% in midwifery roles, who deliver the majority of care in formal sector and domestic work in families and communities, and make the majority of the health purchasing and usage decisions. They hold only 25% of the leadership roles in health, while men, who are only 30% in health workforce, but hold 75% of the leadership role. So the global data shows that only 12% of the global CEOs are women, and only 23% of the global delegates in the World Health Assembly, 22 were women. In Pakistan, around 274,135 registered doctors. 46% of them are female in academia who are published, and 66.5% of the females in dentists are out of 32,000 are the doctors who are published, and 121,246 registered nurses, and 45,000 midwives, and 22,408 lady health workers. But the proportion of the leadership in all these cadres is very low. 75. Another fact is that 70% of the medical students are females, and it is projected that 50% will not pursue the career after graduation. In 2019, 110,000 were female doctors, with 60% non-practicing due to the family responsibilities, which is considered as a barrier for the women being leadership. Women in leadership role in Pakistan are not many, and even less in health sector. One example of that is that out of 114 medical colleges, less than 10% institutional heads are females, and recent CPSP council has only 2 women out of 17 members, which is a big inequality in the leadership in health, or inequality for women in leadership in health. In general, there are only 3 female federal secretaries out of 45 divisions. So this seminar is organized to know more about the reasons for less representation of the female leadership in health sector at decision-making level, and what are the stereotypical barriers, and what can be done to increase the women leadership. So these are the questions we will ask from our esteemed panelists. And I think after this, I will ask Dr. Abid Suleri, our CEO, for the welcome, for formal welcome. And Dr. Abid Qayyum Suleri is Executive Director of Sustainable Policy Institute. He is member of Pakistan Climate Change Council, member of Board of Directors of the National Disaster Risk Management Fund, and Government of Punjab's Vice Chancellor Selection Search Committee for Agriculture Universities. He has previously served as member of the Prime Minister Economic Advisory Council from 2013 to 2022. He has been member of National Advisory Council of Planning Commission of Pakistan from 2013 to 18. And during 21-22, he convened the National Coordination Committee on Prime Minister's Agriculture Transformation Plan. He also served on 3 judicial commissions in environmental issues. Dr. Suleri has represented Pakistan in various official and civil society delegations in the UN, including UN Sustainable Development Policy in Summit COPs, and WTO ministerial conferences. He is actively involved in different regional policy-making forums and served as the lead expert for the World Economic Forum's Transformation Mapping Initiative from Pakistan and many others. Should we clap?
Thank you, Dr. Razia, and distinguished panelists. I feel extremely honored to have the player कि आप सब लोग जो लीडरशिप रोल प्ले कर रहे हैं हेल्थ में, तमाम जो women in leadership role in health sector, उनके दरमियान में बैठा हूँ. लेकिन जैसा कि डॉक्टर रज़िया ने बताया कि this is one of the rare opportunity कि आप इतने सारे women leaders जो हैं उन सबको इकट्ठा एक जगह देख रहे हैं. And I think in your respective fields, it's a galaxy of panelists who are sitting here. Now, आज का जो सेमिनार है जिस पे हम बात करना चाह रहे हैं कि ये जो constellation है ये इतनी rare क्यों है? क्या वजह है कि सारा potential होते हुए क्या वजह है कि हमारे पास इस चीज़ को मानते हुए स्पेशली जब हम हेल्थ सेक्टर की बात करते हैं कि women हमारी हेल्थ सर्विस प्रोवाइडर्स का वो उनका ताल्लुक मेडिसिन से है, उनका ताल्लुक सर्जरी से है, उनका ताल्लुक नर्सिंग से है, उनका ताल्लुक एकेडेमिया से है, क्या वजह है कि वो लीडरशिप पोजीशन पे नहीं आ पा रही? और डॉक्टर रज़िया जैसा कि बता रही थी कि पाकिस्तान के 114 मेडिकल कॉलेजेस और यूनिवर्सिटीज़ में जो लीडरशिप रोल है उसके नंबर्स एंड बट दिस इज़ ए ग्लोबल रिफ्लेक्शन. अगर आप देखिए कोविड के दौरान 115 ममालिक ने जो कोविड को डील करने के लिए अपने सेंटर्स बनाए या अपने जो टास्क फोर्सेस बनाई, उनमें से 85% वर बीइंग लेड बाय मेन. एंड दैट एक्चुअली शोज दिस जेंडर इनसेंसिटिव वे ऑफ कोपिंग विद पेंडेमिक. जब हम सस्टेनेबल डेवलपमेंट गोल्स की बात करते हैं, जब हम लीविंग नो वन बिहाइंड की बात करते हैं, तो बेसिकली उसमें जो एक मेजर अंडरलाइंग प्रिंसिपल है, दैट इज द पॉलिसीज दे हैव टू बी जेंडर्ड बिकॉज men and women they have different needs. Men and women they have different responses. Men and women they require different जो हमारी conditions हैं. लेकिन जब पॉलिसीज जो है वो जेंडर इनसेंसिटिव, जेंडर ब्लाइंड होंगी तो इट इज़ टेकन फॉर ग्रांटेड कि वो एक चीज़ का वो डिजास्टर में है, वो आपके हेल्थ में है, वो पेंडेमिक में है, वो क्लैमिटी में है, कि कोई एक जेंडर न्यूट्रल स्ट्रेटजी जो है वो दैट वुड टेक केयर ऑफ एवरीवन्स नीड, व्हिच इज़ नॉट द केस. SGPI में बिकॉज वी डू लॉट ऑफ फील्ड वर्क एंड प्राइमरी डाटा कलेक्शन, जो एक important चीज मैंने अपने करियर के बहुत स्टार्ट में सीखी, that was the perception of poverty and perception of development needs. और मुझे याद है कि back in 2002 हम उस वक्त NWFP आज की KP में सर्वे कर रहे थे और हम वहाँ पे कम्युनिटी से जानना चाह रहे थे कि आपकी बेसिक नीड्स क्या हैं. शांगला स्वात उस साइड पे, मालाकंड साइड पे. अब हम जितनी मेल रिस्पोंडेंट से जब बात करते थे तो उनकी नीड थी कि जी सड़क जो है ये पक्की होनी चाहिए. उनकी नीड ये थी कि लाइवलीहुड अपॉर्चुनिटीज़ जो हैं वो बहुत कम है. जब हम ख्वातीन से बात करते थे तो वो पीने के साफ पानी की बात करती थी, वो हेल्थ फैसिलिटीज़ की बात करती थी, गर्ल्स एजुकेशन की बात करती थी. और ये इतना वो क्लियर कंट्रास्ट था कि वो एक सिस्टमेटिक कंट्रास्ट अनफॉर्चुनेटली 20 साल के बाद भी जब मैं देखता हूँ तो वो शायद वही का वही है. तो आप जब तक पॉलिसीज को जेंडर्ड पॉलिसीज नहीं करेंगे, जब तक आपको नहीं पता, यानी दोनों को अगर मैं देखूं, सड़क की डिमांड या जॉब की डिमांड विज़ा भी पीने के पानी की डिमांड या स्कूल की डिमांड, तो इन दोनों में शायद इधर आप जो है उसका कॉन्सेप्ट नहीं है. ये सारे इंपॉर्टेंट है. हमें सड़क भी चाहिए, हमें जॉब भी चाहिए, हमें पीने का साफ पानी भी चाहिए, हमें जो हेल्थ फैसिलिटीज़ हैं वो भी चाहिए. लेकिन आपकी एक सेगमेंट ऑफ सोसाइटी जो है, हाफ ऑफ पॉपुलेशन, वो बिल्कुल इन नीड्स को इग्नोर करके और वो किसी एक चीज़ पे फोकस करे, एंड देन दैट गेट्स रिफ्लेक्टेड इन अवर PSDPs एंड दैट गेट्स रिफ्लेक्टेड एट अवर मैक्रो पॉलिसी लेवल, जहाँ पे कि हम देखते हैं कि फंड्स की एलोकेशन जो है वो किस तरीके से की जाती है। तो जाहिर है कि अगर आपके जो पॉलिसी मेकर्स हैं वो वहाँ पे जेंडर रिप्रेजेंटेशन जो है वो नियर इक्वल नहीं है, वो इक्वल नहीं है, तो फिर वो वही कर रहे होंगे जो उनके जहन में, और आई एम नॉट डाउटिंग ऑन एनीवन्स इंटेंशंस हियर, लेकिन ऑब्वियसली जो उनको जहन में ठीक है वो उन्हीं पॉलिसीज पे अमल पैरा होते जा रहे होंगे, और उसकी वजह से फिर हम जो ये डिस्क्रिमिनेशन जिसका डॉक्टर साहबा ने जिक्र किया उसका हमें सामना करना पड़ रहा है। आई होप कि हमें डॉक्टर शाजिया सोमरो जो है पार्लियामेंट्री सेक्रेटरी वो भी ज्वाइन कर रही होंगी शायद, वो जो इस वक्त नेशनल असेंबली का इजलास चल रहा है उसमें शायद बिजी है, लेकिन जब हम पार्लियामेंटेरियन से बात करते हैं, एसडीपीआई इंटरेक्ट्स अ लॉट विद पार्लियामेंटेरियंस, तो इवन वहाँ भी आल्दो के पाकिस्तान टेक्स प्राइड के पाकिस्तान की पार्लियामेंट में जो विमेन रिप्रेजेंटेशन है इज मच हायर देन मैनी अदर डेवलप्ड कंट्रीज पार्लियामेंट्स, लेकिन जब हम ख्वातीन पार्लियामेंटेरियन से बात करते हैं तो ये जान के बड़ा दुख होता है कि इवन द पार्लियामेंटेरियंस दे आर ट्रीटेड एज सेकंड ग्रेड कमोडिटी, कि आप सिर्फ कोरम पूरा करने के लिए है, या आप सिर्फ जो है डेस्क पे जाने के लिए हैं, या आपको चूंकि इलेक्ट होकर आप नहीं आती हैं इस पर और नॉमिनेटेड हैं, तो ये पार्टी का प्रेरोगेटिव है कि पार्टी आपको कहाँ पे वो देखना चाहे, या पार्टी आपसे किस बिल पे साइन करवाना चाह रही। तो ये चीज़ें हमें थोड़ी सी चेंज करना होगी, उनको चैलेंज करना होगा। एक और चीज़ जो कि मैं यहाँ पे हाईलाइट करना चाह रहा था, डेट इज हॉरिजॉन्टल एंड वर्टिकल ग्लास सीलिंग। हमारे पास जो हॉरिजॉन्टल सेग्रीगेशन है, कुछ प्रोफेशंस हैं जो कि प्योरली उनको कर दिया गया है, लेबल कर दिया गया है कि अच्छा बच्चियां अगर पढ़ रही हैं तो बच्चियां पढ़ के वो इन सेक्टर्स में जा रही होंगी, लड़के जो हैं वो इन सेक्टर्स में जा रहे होंगे। वर्टिकल अगर आप देखते हैं ग्लास सीलिंग, तो अगेन आपको लगता है कि इवन विद इन दो सेक्टर्स यहाँ पे के कोट एंड कोट हम कहते हैं कि जी बच्चियों को जाना चाहिए, बच्चियां वहाँ पे जा रही हैं, वहाँ पे भी जब आप लीडरशिप रोल को देखते हैं तो जो जनरल साहब हैं इज वन ऑफ द एक्सेप्शन एंड प्राइड कि माशाल्लाह शी एक्चुअली फॉट हर वे उस लीडरशिप रोल तक पहुंचने के लिए, शी अर्नड इट, शी डिजर्व्ड इट, बट व्हाई वुड टुक 75 years 73 years टू बी इन दैट पोजीशन, जब पाकिस्तान जो है वो आपका इस्लामिक वर्ल्ड में इट वाज द फर्स्ट जो विमेन प्राइम मिनिस्टर आपको यहाँ से थी। अगर आप बेगम राना लियाकत को देखें तो इन दैट टाइम इन अर्ली 50s शी वाज गवर्नर। तो ऑब्वियसली वहाँ पे कहीं ना कहीं पे जो परसेप्शन है और कहीं ना कहीं पे ये रियलाइजेशन कि ऐसा होना चाहिए, उसकी कमी या उसका फुकदान जो है वो नजर आता है कि वी नेवर ट्राइड कि हम इसको बेहतर कर सकें। एंड आई एम ग्लैड कि आज 75th इंटरनेशनल हेल्थ डे पे STPI ने ये टॉपिक चुना, एंड आई एम लुकिंग फॉरवर्ड टू लर्न फ्रॉम द गैलेक्सी ऑफ पैनलिस्ट प्रेजेंट हियर कि हाउ STPI एज एन इंडिपेंडेंट प्रीमियर पॉलिसी थिंक टैंक कैन सपोर्ट this is happening, and how our colleagues and friends from media they can support it happening. Inshallah जब हम leaving no one behind की बात करते हैं, जब हम equity and equality की बात करते हैं, तो वहाँ पे हमें affirmative actions लेना है कि हम women leadership जो है not only in health sector but in every sector उसको promote कर सकें और उसको उसके लिए एक enabling environment जो है वो दे सकें। बहुत शुक्रिया।
Thank you very much, Dr. Abid, for such a wonderful insight, and it's always pleasure to listening to you. So now we are very grateful, and we have a great honor for us. It's a great honor for us that we are joined by a role model in women leadership in health. Our chief guest, Lieutenant General Dr. Nigar Johar, first woman in Pakistan to reach this position. This is she's Army Medical College graduate and has served as Surgeon General of Pakistan and current Commandant of Army Medical Corps Pakistan, and has many other decision-making positions during her career. So thank you, Madam, for joining over. And now the floor is over to you for your comments.
Thank you very much, Dr. Abid Suleri, Dr. Razia Safdar, Dr. Nabila, Dr. Shamsa, August audience, panelists, journalists, ladies and gentlemen, Assalamu alaikum. I really feel honored and privileged to be sitting here today on the platform of this prestigious policy institution. And that is making a huge difference at all levels, as already narrated and said by Dr. Razia Safdar, and I was listening to it, and the achievements are, yes, amazing and wonderful. And I was also listening to Dr. Abid Suleri, and I was happy that so much was coming for women from a man. So thank you very much for doing that. So yes, we are here to celebrate the World Health Day 2023, and the theme of this World Health Day, as we all know, is health for all. So universal health coverage and through primary health care, as you said. And I feel that I would be emphasizing again on 2 points. One that you already said, that yes, we need women, not only we need women equality, but we need the equality to be there, the parity should be there also at the top level. And we also need that the health system should focus more on prevention and promoting health rather than just on diseases and treatments. So I feel that the diversity, that as you said, that different perspectives are needed and diversity is needed. So I would narrate saying that says that diversity is needed, and Melinda Gates said, and I would quote her, that to have results, you need diversity for anything to happen. So we need that, and we need all these, both the perspective of men and women to do that. If we look at, if we say about gender parity and gender equality, then this gender equality was focused it was focused officially in 1978 by the United Nations by their slogan for health for all, and then the most important target was gender equality. And since then, the slogans and the targets and the years have kept on changing. So the slogan was health for all by year 2000, and then it did not happen. So they changed to year 2000 and beyond. It did not happen. So it became Millennium Development Goals. Still, we did not achieve it. So it became, now it is Sustainable Development Goals. The goals kept on changing somewhat. The years of achievement kept on changing. But one goal was always there, and that was gender equality. In spite of that goal that was so important that it was always there, did not achieve gender equality. And when we talk of Pakistan, the Global Gender Gap Index ranked Pakistan amongst the worst countries of gender equality. But when I talk about the healthcare force, as you gave us the statistics and data, in healthcare workforce, when we see the gender equality, so we think that the situation is good because 70% of the healthcare workforce is women, as doctors, as nurses, as paramedics, as midwives. But then why? My question is then why we have such bad women health indices? Why we have those problems? And why the health indices are poor for women both at globally and the national level? Why 70% of the world population living in poverty is women with poor health? And in Pakistan, why maximum women are anemic with low hemoglobin and much more than men? Then why we have the country with one of the highest maternal mortality rate? And why our women in Pakistan are dying more of complication and they are reporting more to the health systems? So when we go into the analysis and important factors, so we come to the same conclusion that you already said, and that is that we have less women at the top level. We have less women at the policy making level. Data shows the higher we go, the lesser we find women. Researchers also reveal that increasing women at the leadership level increases the organizational effectiveness and growth, especially in healthcare, as care and nurturing is natural to women. Yet, even in the countries that claim gender parity, the parity does not exist at the top level. When we say that the 70% healthcare is women, then why 30% of the men in the healthcare are occupying the 75% positions
Exactly.
of the leadership role?
That's the question.
So I feel that it needs to be changed. I find it strange that we understand that women knows more about the women problems and the women concerns, and yet the top level men are mainly making the decisions for the 50% of the population that is women. We are aiming to achieve health for all and universal health coverage. With this, it is not going to happen. So we need to change all this. Females are held back by various factors, but they are especially held back by biases, norms, and stereotyping. So collective efforts are needed and the mindset needs to be changed. Many of us, the young women leaders sitting here, must have struggled and much more to cross these unseen barriers and to shatter these glass ceilings. If I talk of my experiences, yes, I had to struggle a lot. And I had to face all those barriers too. But we all, the leaders, must make difference in our homes, our workplaces, and our cultures, especially we, the empowered women, should be empowering other women. This is another factor that we need to consider. I was myself a third Major General after a decade of a previous Major Generals. Yes, I was a Lieutenant General after 75 years of independence. But when I became a Major General, I struggled and made 4 more Major Generals as females Major Generals. And because of that, and they are all making remarkable differences at their own places. If I talk of them, that would be a history. But I just want to say that one is commanding a bone marrow transplant center, and that has become the biggest bone marrow transplant center of Pakistan with more than 3,000 transplants presently. And then we're talking about COVID-19. So another Major General, she was leading COVID-19 of the military, and she was doing remarkable. So we need to have these women there, and they will make a difference to the healthcare. I talk about the women, and I say that the women need to have freedom from their fears. They have to come out, and they have to work against their goals, but not against men. I will say to the females, please don't blame men, engage men. We don't need gender rivalship. We need gender partnership to have health for all and to have universal health coverage. The universal health coverage index increased from 45 in the year 2000 to around 70 in 2019. But then came COVID-19, and this disrupted all the health services, and the challenges increased. So I feel that rightly United Nations, WHO, and we have this focus on health for all for this year. Ladies and gentlemen, as a public health specialist, my also concern is that when we talk about healthcare, we should focus more towards prevention and for promotion of health, because health and universal health has health, and health is not just treating and curative services. It is also protection and promotion of health and prevention of diseases and rehabilitation. And we, since childhood, know that prevention is always better than cure. To build back better, we need to orient our health system towards preventive services that start by education and awareness of masses. It is the government, the society, mine, and your responsibility to do this. So I feel that we should be doing this. So I would conclude by saying that we are the signatory to sustainable health services, and we are also pledged to have health for all. And for this, we should focus ourselves on more gender parity, and especially at the top level to make decisions and policies for the gender that is affected more. And also, our focus should be oriented more towards preventing diseases and promoting health. So thank you all, and thank you very much. And I'm glad to see some of my friends sitting here, like Shabnam Sarfaraz on the screen, smiling, and Dr. Shamsa sitting here. So thank you indeed. And I stay blessed, stay healthy, Pakistani nation. Zindabad, Pakistan, Paindabad.
So thank you, Madam. So the diversity is needed for the results, and generally, and why women has poor health in spite of 70% of the health workforce is women. So these are the questions to be think about for all of us. So now we have, I will invite our first panelist, Dr. Shabnam Sarfaraz. Thank you, Dr. Shabnam Sarfaraz, for joining from faraway London. And Dr. Shabnam Sarfaraz is the Global Director for the Gender and Health and Deputy Executive Director at Women in Global Health. She is she is a seasoned development professional with over 15 years of experience in leadership position. Dr. Shabnam Sarfaraz was recently served as member Planning Commission at Federal Planning Commission, Government of Pakistan. And she was the one of the first four cohort of the Harvard University Global Health Elite Fellowship in 2019. And more recently, she was honored with the Vice Chancellor Alumni Award in 2021 by the University of Surrey for her outstanding professional achievements. Over to you, Dr. Shabnam Sarfaraz. Though you have so much introduction, but due to the time constraint, I have shortened it up. Thank you very much. Over to you, Dr. Shabnam.
Thank you so much. I hope you can hear me well and the screen is visible.
Yes.
Yes, well endowed.
Thank you so much. Assalamu alaikum, everyone. Such a pleasure being in the room with such an esteemed panel. And thank you for this opportunity to provide a global overview on the status of women leadership in health. The event is very timely. Less than 1 month ago, the Women in Global Health, they launched their flagship report and the state of women and leadership in global health. And Dr. Suleri was using some of the findings of that. So first, allow me to introduce, I hope the slides are moving. And we would not be challenged by आपकी साइड पे slides move कर रही हैं? Again, I'll just put them again. Yeah, okay. So I'll just be introducing briefly about Women in Global Health, and it was founded in 2015 as a volunteer movement by a handful of passionate and committed women. The unequal world of work has, which you have all pointed out, it has been unequal for both men and women. The unequal share of paid and unpaid work, unequal playing fields with underrepresentation of women in highest paid jobs. So Women in Global Health was established to set out on these challenges, which were very rightly pointed out by General Nigar. And this was the rationale behind setting up of this particular movement. Today, Women in Global Health is a registered movement. It started as a movement and now it's a registered organization and has chapters in 47 countries. And there are over 6,000 members amongst these chapters, which are very actively supporting the movement in over 100 countries. Today, it has evolved as the largest and loudest women-led movement. What you see over here is a depiction of where these chapters are, and 63% of them are in low-middle income countries. The leadership team is spread across 6 continents and in 16 countries. And the policy priorities around which the Women in Global Health works is on demanding gender equity in leadership, career opportunities and pay, safe and decent working environments, gender equity in universal health coverage, which the countries are all committed to, and in emergency preparedness and response. The WGH builds alliances and our movements are aimed towards a world that enables women from all regions to be leaders in global health and catalysts for better health for all. In 2021, they launched the Global Gender Equal Health and Health Care Workforce Initiative, which they co-lead with the government of France. And this initiative is around building political community and taking this forward by engaging the governments. To date, we have 16 governments, including the government of Pakistan, who are supporting this initiative, and there are multiple international and local NGOs who are part of it. While there are several reports which have been published and data has been generated, because these reports are critical to taking the advocacy forward. And the latest one being the report on the state of women in leadership. And there are few upcoming ones. And this report was published, released some of the findings by the Harvard University last night. And the new analysis depicts that the progress along the women leaders and has not changed. So in 2018, when we saw that 70% were health workers, were females, and only 25% at global level were in leadership roles. In 2023, we see the same, and we didn't see any progress or any change in the statistics despite 5 years of the last report. So what you see over here is that women are clustered in low categories, and as you move up the career ladder, we see less and less women occupying the positions in the top hierarchy. Again, the gender. This is an interesting slide, which I was part of a panel yesterday at the 5th Human Resource for Health Forum in Geneva, which shows that how the health sector is more attractive towards women. And in 67% of the global health workforce in 2020, even documented by WHO, are females. The study that was conducted by WGH on the status of women depicted that, and there is quite variation among the different countries. So what you see over here is that in Kenya, women hold 40% of the top leadership positions. And when we move on to India, there are 28% of the leadership roles go towards women. And in the context of Pakistan, I would first try to give you a background on the gender dimensions which permeate through the health sector. As mentioned by General Nigar, Pakistan's ranking has been stagnant across the multiple gender indices over the last 10 years. However, while serving at the Planning Commission Government of Pakistan and leading the National Health, Education and Gender portfolio, we recognize the need to unpack and delve deeper onto these indices as we worked on understanding them better. The indices are made of 16 sub-indicators, and what is promising is that we see the female literacy improving in younger age groups, whereas Pakistan is listed as a country with taking the highest burden of out-of-school girls in the region. But this is a silver lining, and more promising is that the gap is pretty closed at the higher education level, where we see a lot of young girls in universities. So we have a higher number of girls, that is 55%, doing pre-medicine, while only 23% are opting to take up pre-engineering subjects. 60% of the applicants to medical schools were females in 2022, which indicates that they tend to do much better than boys in terms of meeting eligibility criteria. They outperform the boys in the entry test and take up 70% of the seats consistently in medical, dental, and allied health schools. However, we see a sharp decline in the labor market, with only 46% females serving as doctors and 66% as dentists. The number declines further as only 35% females manage to do post-graduation. So there is a loss from 70% in medical and dental school to an overall 49% females serving as doctors and dentists. Whereas women labor force participation in Pakistan stands at a dismal 22%, the health sector still has a much higher number of working women, despite the 21% exit that we have as they get into after they qualify. This loss of female doctors after qualifying has been recognized as a challenge waste of taxpayers' money, giving them a globally popular narrative around doctor brides. Young women in Pakistan are extremely keen to enter the healthcare and allied field. This is reflected in the strikingly high female enrollment in medical, dental, and nursing schools that I just shared. Unfortunately, a number of barriers affect a large percentage of these talented, passionate, and qualified young doctors from advancing their careers, and a high attrition rate is a growing policy concern. Instead of recognizing gender inconducive working environment as the major factor responsible for the same, they are labeled in the male-dominated national policy arenas as doctor brides, that is, young women pursuing the 5 years of intensive medical education to find good marital match only. This has driven the focus away from addressing some critical issues like inflexible work schedules to allow for work-life balance, lack of daycare centers, etc. And in 2014, it led to a policy decision for abolishing the open merit policy for entry into medical colleges and imposition of a 50-50 quota system, which was discriminatory towards the female students who were otherwise qualifying for the seats on open merit. This was, however, challenged by the female students and supported by a female in the High Court, and we were able to overturn this, and because it was an unconstitutional imposition. Females make up 80% of the nursing workforce, and they are the largest cadre to migrate, particularly the male nurses. They make up almost 100% of the community health workers, and they are critical to achieving the universal health coverage, as they are the sole providers of healthcare to over 60% of the population. Pakistan is a country with critical shortage of health human resource. Globally, it is 0.8 doctors to a nurse, but in Pakistan, the ratio is inverse. We have a shortage of 7 lakh nurses. The major bottleneck is that we do not have MSc and PhD nurses in the country to train the bachelor cohort, as we phased out the diploma program. This helped us in advocating and successfully gaining 1,000 MSc and PhD scholarship for nurses in 2020, and the program is in its 3rd year of running. And it's a critical program for taking the nursing profession to another level. Health is one of the most important employment sector for women, and even today, despite the exit, 70% of the health workforce today is still women. Men are the majority of surgeons, policymakers, and in high-paying leadership roles. Women are fast exiting due to the gender challenges they face and the insensitivities towards these challenges that prevail at the policy tables due to their absence or scarcity at the senior leadership level. Women in global health are indeed the labor, but very rarely the leaders. They are not the doctor brides. They are the ones who outperformed exceptionally well in academics and made their way to medical and dental and nursing colleges. They are the ones who, after 5 years of most intensive studying, end up paying the motherhood penalty and exit due to insensitive workplace policies coming in way of achieving their work-life balance. It was against this background that the Women in Global Health Pakistan chapter was launched by a big group of very committed, passionate women in 2019, and we were one of the first chapters to be established in Asia. All of us who were part of this launch event have never forgotten the passion, the commitment, and resilience of the women leaders who came together and added their voice to the movement, and together turned the chapter to become one of the most vibrant chapters across the globe. The chapter conducted a study on identifying barriers and facilitators for career advancement among women leaders of Pakistani descent. 65% of the women identified gender-specific barriers hindering their career progression. Immediate supervisors and parents-in-law were listed as being least supported in anchoring their careers. Leadership trainings and mentorship were identified as the biggest enabling factors, and 87% of these senior women leaders are willing to mentor young aspiring leaders. Another study was conducted to study the gender-conducive work environments across 42 federal ministries when I was at the Planning Commission. We mapped facilities for women working in these ministries, and you can see In reds, that the lack of facilities which are critical to women. Even today, there are several ministries which do not have dedicated cafeterias, daycare facilities, or even toilets for women working in these ministries. The gender disaggregated data that over here shows a sharp decline in female numbers at the highest scales within the bureaucracy. At the top scale, we had only 1 woman considered for promotion against 9, so 10% against 90%. These findings were successful in getting 2022 declared as the year of respecting female employees by the government of Pakistan. One of the upcoming studies of women in global health is on leadership role, that community health workers, a concept that was hard to register in Pakistan as community health workers lack a career path. It is a multi-country study in which women in global health led the component of Pakistan, and I'm proud to say that the report was labeled as exemplary for other countries to follow. As part of the report, we studied the phenomenal movement led by the community health workers and how they have emerged as a resilient, committed coalition and have organized themselves for the future they aspire for themselves, and have succeeded in getting some of their charter of demands accepted. Their demands were rightfully for equal rights as available to other civil servants. The program today stands regularized owing to the struggle of the lady health workers themselves, and is a flagship program that we continue to celebrate across the globe. We do not recognize the community health workers as being leaders, whereas they fulfill so many criteria of being one. They are for empowering others, their collaborative approach, the value-driven leadership that they practice, the adaptive leadership in the communities that they are in, and they are the service leaders in the communities that they're serving. The study witnessed community health workers as being leaders, whereas they fulfill so many criteria of being one. The study also witnessed community health workers from Pakistan emerging as influential leaders whose impact goes far beyond health to social and economic benefits and creating sustainable communities where they're serving. From 2020 to 2022, we have in Pakistan pursued an aggressive agenda and supported the government of Pakistan into conducting several research studies, securing the scholarship that I mentioned, and also we together launched the National Gender Policy Framework last year at the International Women's Day. We have been generously receiving the support from WHO Country Office, as well as multiple partners and key stakeholders for advancing this critical agenda. Today, the WGH has 47 chapters in 44 countries. Pakistan has emerged as one of the high impact chapters. Changing the status quo will require sustained action from all of us. The key recommendation I would like to list here are to create tailored leadership opportunities for women, particularly from marginalized backgrounds who have missed out on formal education and other opportunity. Fast-track measures to correct the gender imbalances in global health leadership while committing to hiring and appointing women for empty leadership posts. Mobilize men. It's very rightly pointed out, we have to have men as allies and create more equal workplaces. Do not make them as enemies. And we must try to end the default man bias and prioritize accountability for policies that support women leaders, including legal frameworks to ensure zero discrimination and harassment, flexible working hours, safe spaces for mothers as well. Women are already shaping health and in their countries and are ready to lead at the global level. More diversity is, as pointed out very rightly by General Nigar, is extremely critical for the potential gains for public health systems around the world, the social change, as well as economic growth. Women can and should be leading global health. I'm really grateful to STPI for hosting the session today and also for taking up the topic of women leadership to celebrate the International Health Day. Thank you so much for your patient listening. Thank you.
Now we have a very well-known public health expert, Dr. Nabila Ali. She's the country representative of JSI. and she has the 35 years of experience working with both the government and the non-government organizations. And for effective, she is the leader in effective health programming in Pakistan, and she is as an expert in public health and system strengthening for RMNCH and global health security. Dr. Ali has worked at all 4 levels of health system, from federal, provincial to district and community level. She is a well-respected public health leader and practitioner. Dr. Ali is recognized globally for the contribution in generating evidence for policy and design program for poor and marginalized in Pakistan, leaving no one behind. Such as, Dr. Ali, as she has worked in community as well as and all 4 levels. So my question for you is, what is the situation of women leadership in Pakistan and region, and what are the cultural, social, and maybe religious barriers, as you have been working at all 4 levels? If you can highlight women health workers' participation at district level and leadership positions. Thank you very much. Over to you.
Bismillah ar-Rahman ar-Rahim. First of all, I would like to thank SDPI for choosing such an important topic at a very pertinent day. Thank you, Dr. Abid Suleri, General Nigar, Dr. Razia, Dr. Shamsa, distinguished guests, Dr. Shabnam, ladies and gentlemen, media, everybody, Assalamu alaikum. I am not going to repeat what has already been said by Dr. Razia, by General Nigar, and by Dr. Shabnam, because they have really set the stage. I'm going to talk more from the systems level and how, women face some barriers in reaching to the leadership positions within the system, and also some of the experiences and examples which are really a ray of hope, the silver lining, Dr. Shabnam, as you mentioned. So when I joined the health department, I was one amongst many women medical officers. But very soon I realized that the decision-making lies in the hands of the male members of the health sector. And I'm not against that. But the thing is that if we look at the disease burden, 70 to 75% of the disease burden for primary healthcare has to do with women and children. So when we looked at how the programs are shaped, how and who is shaping the programs, and are they relevant to our context? Are they relevant to the needs of the community or the needs of women and children? The answer was no. As late as 2003, we started off by introducing community midwives in Pakistan. And that time, I was heading the project Pakistan Initiative for Mothers and Newborns by the name of PAMAN. We said we need community midwives because 70% of the births, they take place at the community level. And there are no skilled birth attendants available over there. They're traditional birth attendants, and women are dying needlessly, and newborns are dying just because nobody's there to provide a service that can save their life. So with the successful year and a half experience of introducing the community midwives within the communities, saw a very positive result. And when we presented to the ministry at that time, and I remember that the Prime Minister at that time was Mr. Shaukat Aziz, and this was 2004. And we said, we need a national maternal newborn child health program. Can you imagine when did the national maternal newborn child health program was introduced in Pakistan? It was 2004, and implementation started in 2005. That's when it was decided. At that time, there were 50,000 villages in Pakistan. So the decision was to have at least one community midwife in each village. But we are still very far away from there, but slowly and gradually we are reaching to that point. And the statistics, which were static for decades, they have shown increase in skilled birth attendants over a period of time. And Pakistan Demographic Health Survey is a source that we can all go and see. So when the decisions were made, by a group of women, who realized that our interventions are not at the right time and the right place. We are offering services through the health facilities, but women are delivering at home. And another study showed that women and newborns soon after delivery, the number of deaths is highest within the first 2 to 3 days. And that is the time when there is no one to take care of them within the community. So that's when the community midwifery program and MNCH program started. I would also like to share, because there are some unwritten norms in our society. Women, we were all, including myself, we were all brought up and given education to get good rishtas, good match, get married, to in nice families, and start your life from there, not the career. So our education was not to pursue our profession or our careers. It was more to do with getting, better match, being a doctor. Okay, she's a doctor, good match. So that is not what should have been, the norm, but it's an unwritten norm, which I'm sure most of us can relate to. We all need very supportive husbands and very supportive fathers. And I'm one lucky person to have Allah Jannat Naseeb Kare, my father, and then my brothers, and then my husband. In public health, where you have to go to the field, you have to make your feet dirty to understand the context, and you can't plan if you don't understand the ground realities. Who would allow their wives to go alone, stay there, overnight, come back, and still have trust in them? That is a big, trust deficit that exists. And that's why it's not that women are any less than men when we talk of competencies or skills or interest to work. It is just, these unwritten norms that women, ye raat jaake baar wahan pe reh ke aayegi 2-3 din, pata nahi kya hoga udhar. So these are some fears which exist. So we need the support of men, as General Nigar has said, Dr. Shabnam, and you also mentioned, we need to work as partners, and provide services where they are required. I would like to share one example. Dr. Shabnam talked about a study of 45 ministries. We were providing support to the Ministry of National Health Services Regulation and Coordination to qualify for ISO certification. And one intervention that was suggested and actually was accomplished was a female washroom. There was no dedicated washroom for women within the ministry. And it was, I was surprised that it was a top request. And we were all like, what? Is this the request? Amongst so many, they were in the list of priority, that was number 1. So just sharing with you that as small as having a dedicated female washroom, so because those who were, planning the structure and the buildings and others, they never realized the importance of this because we do not have women leaders, at that level. I'm talking of late 80s, there were, internally displaced people, and I had a chance to go to Charsada. And I went there and I talked to women in the camps. They were pregnant women. They were young women, girls who had their monthly, periods. And I said, when they saw a female, they all flocked around me and they said, we need this. We don't want food. We want, the sanitary pads. And I looked at the list of things which were to be provided to them, and it lacked that. And then it was added. So if we have women in decision-making positions who can influence the design of the program, that's when it was. Pregnant women said, we can't lie down on the chatai that is given to us because, we can't even turn. So हमने पूछा उनसे आपको क्या चाहिए? उन्होंने कहा हमें मैट्रेस नहीं चाहिए फोम वाला. We need रुई वाला गद्दा जो सॉफ्ट हो और उस पे हो. मगर मैंने कहा आपने क्यों नहीं बताया किसी को? उन्होंने कहा हमसे किसी ने पूछा नहीं और हमें शर्म भी आती थी, उनको कैसे हम बताएंगे. So that is where, you know, in humanitarian relief work, even in the times of COVID, we have seen that the needs of women, they were overlooked. I was reading the report that Dr. Shabnam, you mentioned, and there was a mention about the PPE, the personal protective equipment that, you know, the gown that healthcare providers had to wear for infection prevention control. It is designed for men, for the body of a male, not for female. As a result, they could not, and for women, they have to take it off to go to the washroom, and they could not. So the women, you know, they cribbed and they said that the whole day we did not use the washroom because we were wearing the protective gear, you know. So simple things as that. Pakistan is one of the countries where nutrition is a challenge. General Nigar talked about anemia in women, you know, and it can be easily treated. But the thing is that the nutrition program, the design of the nutrition program since Pakistan came into existence was not tailored to address women's needs. And we have seen, you know, as a result that simple indicator percentage, hemoglobin percentage, we are still around 50%. Women have anemia in Pakistan. So these are simple things that can be overcome by good planning and good. We often talk of governance because I'm from health systems, so it's impossible that I don't talk about health systems. So in health systems, what is good governance? It is a good plan. Then you have transparency. What are you doing? How many stocks are there? What are you providing? Is capacity development taking place? And then the last thing is accountability. We do not have women in any of these three categories, neither in planning nor in bringing transparency in the system or talk about it, and then the accountability. There are excellent reports. Who reads? To redesign the program next time. So that is why, you know, women leaders are really required. And as I said, they need support of men because they need the confidence of their husbands and their fathers and their brothers to move in areas where they can go, listen to the needs of women, and then come back and plan accordingly. अच्छा, बड़े मजे की एक बात हुई कि बलूचिस्तान में maternal mortality, जो माएं मर जाती हैं प्रेगनेंसी के दौरान, is the highest, 850. हर 1 लाख बच्चा जो पैदा होता है उस पे 850 mothers they die. जबकि पंजाब में और बाकी जगहों पर the number was less than half of it. मैंने कहा कोई तो रीजन होगा ना बलूचिस्तान में क्यों इतनी ज्यादा mortality. I went down to the districts और वहां पे जाके जब पता किया तो मैं डिप्टी कमिश्नर के पास गई, एक डिस्ट्रिक्ट है, आई नॉट नेम. मैंने कहा जी यहाँ से आपको लेडी हेल्थ वर्कर्स कैसे मिलेंगी, कम्युनिटी मिडवाइफ्स कैसे मिलेंगी, बिकॉज देयर इज ए क्राइटेरिया कि 8वीं या 10वीं पास हो लड़की या उसने FA किया हो, तो आपका तो प्राइमरी के आगे स्कूल ही नहीं है उन डिस्ट्रिक्ट्स का. तो हाउ कैन वी ब्लेम द पेरेंट्स और द गर्ल्स for not getting the required education? आपको तो अगले 50 साल तक भी नहीं मिलेंगी यहाँ से lady health workers, and क्योंकि least number of lady health workers and community midwives in Balochistan where maternal mortality is the highest. मैंने कहा इसके बारे में हमें कुछ करना है. We came back, talked to Allama Iqbal Open University, lady health workers program, तब अभी devolution नहीं हुई थी, और कम्युनिटी मिडविफरी का जो MNCH प्रोग्राम था उनसे बात की और इलामा इकबाल ओपन यूनिवर्सिटी में उनको कहा कि आप अगर हम आपको बलूचिस्तान और KP के जो कुछ एरियाज हैं वहां पे एक्सेलरेटेड एजुकेशनल प्रोग्राम की सहूलत दें. बहुत कम खर्चा आया. पब्लिक स्कूल्स में ही शाम के वक्त टीचर्स को उन्होंने ट्रेन किया. वो इन लड़कियों को जिन्होंने प्राइमरी के बाद आउट ऑफ स्कूल थी उनको ट्रेनिंग दी. वो बोर्ड के एग्जाम में बैठी 15 महीने के बाद. ऑल ऑफ देम टॉप नहीं किया तो पोजीशंस ली उन्होंने क्योंकि इतना टैलेंट था उधर. और 2000 लेडी हेल्थ वर्कर्स और कम्युनिटी मिडवाइफ्स जो थी वो उन एरिया से निकली, और बलूचिस्तान में भी कम से कम एक हेल्थ केयर प्रोवाइडर कम्युनिटी लेवल पर उनको मिल गया। सो हमें वी हैव टू थिंक आउट ऑफ द बॉक्स। एक वो था ना कि ये एक क्राइटेरिया है, इस पे नहीं फुलफिल करती तो क्या करें, हमारे तो हाथ बंधे हुए, बट वी नीड टू सी कि उसके नीचे उसके रीजंस क्या है। वी नीड टू गो एंड एक्सप्लोर दोस। अच्छा, एक और मैं आपसे वो करना चाह रही थी कि देखिए हमारी जितनी भी होती है ना ऑर्गेनाइजेशन जिनमें 9 to 5 टाइमिंग्स होती हैं, वहां पे अब यंग गर्ल्स को हम कैसे अट्रैक्ट करें? उनके छोटे छोटे बच्चे, हम कहते हैं वो एक्सक्लूसिव ब्रेस्ट फीडिंग करें बच्चों, वो बच्चे घर छोड़ के 9 से 5 वो बच्चे तो बेचारा डिहाइड्रेशन से ही मर जाएगा, माँ का दूध ही नहीं उसको मिल रहा अगर हमने ब्रेस्ट फीडिंग को प्रमोट करना है। तो मैं जब एक इदारे में इससे JSI से पहले आई वॉज हेडिंग अनदर ऑर्गेनाइजेशन, वहां पर भी हमने एक कमरा बनाया, डेडिकेट करना था ना कमरा, वो अपनी मेड्स खुद लाती थी, बच्चा अपना साथ लाती थी और जाके उनको टाइम पर 2-2 घंटे के बाद उन्हें फीड करती थी। एक और चीज मैंने देखी, क्योंकि हमारा जो पब्लिक सेक्टर में और हेल्थ सिस्टम्स में काम है वो एक तो पॉलिसी लेवल का काम होता है और दूसरा होता है टू गो इन द फील्ड एंड वर्क देयर और उनके साथ भी काम करना, बिहेवियर चेंज के ऊपर काम करना। मैंने देखा कि मुझे तो 5 स्टार होटल में ठहराया जा रहा है और जो बाकी हैं उनको, अगर हम क्वेटा गए हैं तो नीचे बस का स्टैंड है, तो ऊपर वाला जो है ना कि जी इनका 1500 है, इनका वो इनकी जो ऑनर एरिया जो भी इनका लॉजिंग का जो है वो इतना है स्टैंड। वो लड़कियां कहें कि जी वो इतना गंदा माहौल है वहां पर कि हम नहीं उधर जा सकते, उधर लोग हमें अजीब नजरों से देखते। आई चेंज दैट पॉलिसी। मैंने कहा जो भी फील्ड में जाएगा वो एक ही जगह पर रहेगा, चाहे वो बिल्कुल स्टार्टिंग पोजीशन पे वो लड़की आई है किसी ऑर्गेनाइजेशन में या वो चीफ ऑफ पार्टी है, दे आर ऑल गोइंग टू स्टे इन द सेम होटल इफ वी वांट टू इनकरेज विमेन टू गो एंड पार्टिसिपेट एंड डू सम वर्क। अदरवाइज हम उनको वो फिर छोड़ जाती हैं काम कि नहीं जा सकते। मेरे अपने साथ हुआ, वी बिलोंग टू ए रूरल फैमिली, हमारी बैकग्राउंड जो है वो रूरल है, तो मेरे ससुराल में एक शादी थी। I could not go because I had a workshop at Health Services Academy. In those days, I was teaching there. तो मेरे हस्बैंड गए, उन्होंने कहा नबीला नहीं आई, उन्होंने कहा जी उसकी एक वर्कशॉप थी। तो उन्होंने कहा हाय हुन तेरी बीवी जड़ी वो वर्कशॉप च काम कर दी है कि भाई वर्कशॉप में शायद कोई कार्य कर रही है या कोई और काम कर रही है ना। तो इस उन्होंने फिर उनको एक्सप्लेन किया सपोर्टिंग हस्बैंड अगेन, उन्होंने कहा नहीं ये और वो करके सारा with the passage of time everybody understands कि ये क्या काम कर रहे हैं क्या नहीं कर रहे हैं, अच्छा काम कर रहे हैं। तो मैं आपको बता रही हूँ कि ये चीजें डिमोटिवेटिंग होती हैं और आपको नीचे पुल फैक्टर्स होते हैं, बट एक दूसरे का हमें सपोर्ट करनी है। जैसे डॉक्टर निगार ने कहा, उन्होंने बहुत सी फीमेल और जो थी उनको इंट्रोड्यूस कराया और ग्लास सीलिंग को शटर किया। इसी तरह ही मेरा अपना मैंने और डॉक्टर शबनम के उसमें भी विमेन ग्रुप जो है उसकी भी मैं मेंबर हूँ। मैंने अपने लाइफ का एम बनाया हुआ है कि यंग विमेन उनको इनकरेज करना, उनको मेंटर करना, हाउ टू कम इन द लाइमलाइट एंड आल्सो इन द लीडरशिप। With that I left. Thank you. There are many stories, but I'll end here.
We are, thank you very much, Dr. Nabila. We are joined by Dr. Shazia Sobia Sumro, Parliamentary Secretary for Ministry of Health, and she has joined virtually. And we welcome you, Dr. Saiba, and she is the chair of this session. And we are looking forward to hear from you. And now the next panelist is Dr. Azizun Nisa, who is President SOGP, Society of Obstetricians and Gynecologists these days. And she has served at many places and trained many young doctors who can be the leader in the future or who are in leaders in future, and how they can work in the field to change to break this glass ceiling. So welcome Dr. Azizun, Madam Azizun Nisa. Madam, most of the females, my question for you is that most of the female doctors are in gynecology, almost 95%, but very few in the leadership role. And with global recognition, in recent CPSP Council, only 2 females out of 17 members are women. According to you, what is the reason for this? And secondly, you have been in training for a long time, and is there any module or priority on training of the young doctors for leadership roles? Thank you very much. Over to you, Doctor.
Okay, can you hear me?
Yes, please, Later.
Okay, Assalamu alaikum everyone. Thank you STPI and Dr. Razia for inviting me. I really feel honored to be part of this great activity today, and many congratulations for arranging this activity. Very nice talk from the panelists. A few words about my organization. It's a Society of Obstetricians and Gynecologists of Pakistan. Is a huge organization. We have around 5,000 life members who are mostly obstetrician and gynecologists. And we, besides Central SOGP, we have 30 sub-chapters in all the big and small cities of Pakistan. And every chapter has got 13 to 14 executive council members. So in spite of having so many doctors and gynecologists, we are not coming down on our maternal mortality. And Pakistan is, I think, topping the world. Even in Southeast Asia, we are on the top in triple mortality. That is maternal mortality, perinatal mortality, and neonatal mortality. So we were enrolled in SGDs, and by 2030, we need to come down on MMR by 73. And at the moment, we are on 176 per 100,000. So the reason is that most of these deaths we get from the periphery. And 80%, the recent demographic survey shows that 80% of the deaths were from the rural areas, and 80% were the women who were uneducated. Even the primary and middle class saved the mother. But what we need to do, if we want to have women empowerment, we need to concentrate on the female education, girls' education. And women empowerment comes from education, good jobs, and financial stability of the ladies. In SOGP, we are 95%, 96%, we are female gynecologists, and male gynecologists are only 4 to 5%. But on every stage, there's a conference, a seminar, or the workshop, all the stage chairs are filled with the male gynecologist. And it is the same everywhere. I remained Dean of AYUB Medical College for 2 years. And in the board, I was only lady, and they used to say that this is the lady, and she is a gynecologist as well. And why she's so vocal? Because the male dominant society, they don't allow us to come out. At the moment, we are getting an LDI project. We are working on a leadership initiative project, Melinda Gate from FIGO. FIGO is International Federation of Obstetricians and Gynecologists. And we are going to sign an MOU with them, LDI project in Pakistan. And that is mainly development of the female leadership and leader gynecologist to prevent MMR. And we have chosen 2 topics. That is, one is eclampsia and one is PPH, which is the major cause of maternal mortality. 80% of our deaths are due to these 2 reasons. So we are going to do advocacy on this project all over Pakistan, and we will advocate this project through organization like your ones and other organization, and also the people working on the key post in the health department. And we are also advocating that the gynecologist should be made part of the policy which is made for the female patients and MMR and perinatal mortality, and the input should be taken from the gynecologist as well. Even the problem in Pakistan is that leadership, as Dr. Azia mentioned, that there are only 2 members out of 17 in central CPSP. So we need to advocate that more and more ladies should come out. And as Dr. Nabila, someone else said that we are producing female doctor brides because parents think that if they become doctors, they will get good match and like that. And 80% of the female doctors, they sit at home, they become housewives. So we all need to work on this thing, leadership development among the ladies. And thank you very much for taking me on board on this important topic. Thank you.
Now we have with us Dr. Shamsa, who is working at Quaid-e-Azam, who is General Manager Clinical Audits at Quaid-e-Azam International Hospital, and she has been working as in public sector as well as in private sector. She was old PAF Pakistan Air Force sector doctor, and now she has both experiences. So I would like to ask her that how are the women decision makers integrity and attitude is taken at on both sides, like in private sector as well as in public sector, and also what is the how different is the glass ceiling in both the sectors? So can you compare some, or can you share your experiences with us? Thank you very much.
Hello, everyone. Thank you so much.
Can you open the mic?
Thank you so much for inviting me and talk to such a prestigious group of people. She has already introduced that I have been in health sector for good about 30 years, more than 30 years. Please don't judge my age, but so I'm here and I had opportunity to work in both public and private sectors. So if you ask me, and she has asked me what is the difference, but to tell you the truth, since I've worked in both, and since Dr. Nagar is also in the same category almost, but almost she has achieved very high pedestal in her career. But I would say that almost Kamobesh, we face the same criterias, the same barriers we are facing, including gender equality, and then comes the gender discrimination, then we don't get the equal opportunities. I think I am one of the only one out of so many people in the private sector. But still, I think in private sector, we get more opportunities. We are filtered out through many channels, and then we are exposed. By the time I have come to the private sector, maybe they think that I have experienced enough in the public sector, so I can, put my experience into the private sector and get some positive results. But as far as the problems are and the barriers are concerned, we've already covered almost each and everything by all these my fellow members. But I think a few of the topics which I would like to discuss are, other than gender equality, gender discrimination, and we don't get equal opportunities in promotion. And that is very important in the public sector also. And there was a survey done by Pakistan Medical Identity Council in 2017 that 51.4% of female doctors, they experienced gender discrimination, and they were not promoted to the as their male counterparts were. They were given the promotions. So there are so many things I can talk about. The few things which I think I can discuss are the harassment. Harassment at the workplace is very common. People are scared to send their children there because of the harassment issues. And if some woman speaks about it, then she faces retaliations. And then she becomes subject to social stigma. and then she has that negative career opportunities onwards. So all these factors, plus I think another problem which I face is that, again, I will not go into details because all, as she has already mentioned, that we have come up to this position and we all have stories to tell, that will take very long, that how we, fought and then played our role, worked really hard, and then we had to prove at so many places as compared to men. It was very easy. And then as far as decision making is concerned, again, then women, their representation is very low. But as everybody was suggesting, I think 25%, as you said, that 25% out of 70% of women representing in Pakistan, they are at the decision level, decision making levels. They are at that place. But a study was published in Ayub Medical College way back in 2016, and then that representation was only 11.6%. So then again, there's a silver lining. I can say that things are improving at our behalf, and that Vyavastha Rahe Shajar Se Umeed Bharat, we all can, go like that. एक चीज जो डॉक्टर नबीला अली ने जिक्र किया, that we should, she's very grateful अपने वालिद की, and ये इसमें मैं थोड़ी सी patriarchal social norms की भी बात करना चाहूंगी कि we take certain things that not that I'm not grateful to my parents, to my father, but I should also mention my mother also, because she was equally participating. She was working, she was getting up in the morning, at night for me. She was breastfeeding. She had so many domestic constraints, yet she was looking after me. And then my father was going to office, and then he was the decision maker for me. See? And चाहते ना चाहते हम कहीं ना कहीं आदमियों को ये नहीं कहती मैं कि not to negate their roles. Yes, they play a very important role, but yet I think somewhere we should think that this is also a right. We are born women, and this is our basic right to achieve all this. What we are, why we should always be grateful to men for giving us liberty to be. Yes, we are going somewhere, then we should be grateful to them. No, they are going somewhere. They are not grateful that we are letting them go and leaving the 10 kids behind, and we are looking after that family. But we have to be grateful. Even he's even good to our parents. That is considered as, yes, he's so sweet. He's looking at. So some social norms we have adapted in our way, that we are tuned. We are made to think that way, that somehow or the other we should always be grateful to men. So that has led to men having this decision-making authority. That yes, we are deciding their future, we are deciding partner for them, we are deciding everything for them, that they should go to a medical college, or they should do this, or they should not do that. And then they automatically think that that is their basic right. That's how things get worse. And we are all being educated, going to such positions. We are still at back of our mind. We are still very much grateful for them being nice. That is our basic right, that they should be nice. Why they should not let us flourish, as much as they are very happy to say, I'm talking about, I'm proud mother of 3 daughters, and they're feminist, I would say. And through them, I have learned so much, and I'm learning every day. And she was posted somewhere. I mean, she got a very good job at Karachi. And then my husband suddenly said, no, you cannot go to Karachi. हालात अच्छे नहीं हैं. She said कि अगर आपका कोई बेटा होता तो आप उसको बड़े आराम से भेज देते. She said, I'm being a protective father. She said, I love that. You are being protective. But कहीं ना कहीं you are scared. ठीक है? तो बात ये होती है, there's so many things I can talk about. But आदमियों को हमें ट्रेनिंग देने की बहुत सख्त जरूरत है. It is very, very important that they should think that women जो हैं, उनका भी उतना ही राइट है जितना आदमियों का राइट है. तो ये चीजें थोड़ी सी अगर हम आदमियों के बारे में ज्यादा प्रोग्राम रादर देन औरतों के एम्पावरमेंट के लिए कर रहे हैं, तो उतनी इक्वली अगर हम आदमियों की सोच को भी बदलने के लिए भी कोशिश करें तो काफी फर्क पड़ सकता है. Another thing we are talking about, one more thing, marriage. यहाँ पे चाइल्ड डॉक्टर ब्राइड का बताया जाता है. अगेन हमारी लड़कियां, हमारी माएं ही और हमारे बाप ही मिलके ये फैसला करते हैं कि इसको डॉक्टर बना दो, रिश्ता अच्छा मिल जाएगा. इट इज नॉट फेयर ऑन देयर बिहाफ. हम अपनी कमजोरी जाहिर कर रहे हैं. हम अपनी लड़की को इतना कॉन्फिडेंस क्यों नहीं देते कि वट एवर यू वॉन्ट टू बिकम, यू बिकम, वी आर विद यू. देखी जाएगी, शादी भी ना हुई, इट्स नॉट एंड ऑफ द वर्ल्ड. ठीक है ना. हमें उनको कोशिश ये करनी चाहिए कि हम उनको बताएं, जी तुम जो चाहती हो दुनिया में उड़ान रखो, पर लगाओ, घूमो, जो मर्जी करो, तुम खुद सोचो, हमें तुम्हारे लिए सोचने की जरूरत नहीं है. ऐसी हम ट्रेनिंग करें उनकी. और यहाँ तक ये शादियां जब होती हैं और लड़कियां अपनी जॉब वगैरह छोड़ देती हैं, तो आई हैव अ वेरी हम्बल सजेशन दैट शादी से पहले हमारे यहाँ काउंसलिंग का रिवाज नहीं. आई थिंक मैरिज काउंसलिंग बहुत जरूरी है रिगार्डिंग लड़कियों का जो करियर होता है. लड़कों का करियर अच्छे होने के लिए हम उनको बाहर भेज देंगे, हम उनके लिए सब कुछ करेंगे, लेकिन लड़कियों के करियर की बात आएगी तो वहीं पे हम ये कहेंगे नहीं नहीं नहीं, घर बनाओ, घर समझाओ, यहाँ बैठ जाओ, ये नहीं करना, आगे नहीं बोलना, फला नहीं करना. तो हम कहीं ना कहीं खुद जिम्मेदार हैं अपने बच्चों को इस तरह के अंडर कॉन्फिडेंट बनाने में. तो मेरा ख्याल है मैरिज काउंसलिंग बहुत जरूरी है, जिससे चाइल्ड ये जो डॉक्टर ब्राइड्स हैं, मेरा ख्याल है उनको भी कुछ सोच में शायद चेंज आए और उनके पेरेंट्स को भी समझाने की जरूरत होगी. ये इससे मेरे टॉपिक से रिलेटेड तो नहीं था, बट ऑलरेडी आप लोगों ने इतना टॉपिक डिस्कस
Thank you very much. Very valid points, and points are taken. So you can see with the claps. And now we have our last panelist, Dr. Sabah Shuja. She's in Sindh and she is working with UNICEF. And we will ask her experiences. She has also a long list of her work, but due to time shortage, I would like to ask her that you have been in INGO, which has high values and principles, and equal opportunity organization. It will be good if you can highlight on barriers to come to the decision-making level at your organization, and what are the promoters of the women leading leadership in INGOs. Thank you very much. You have 5 minutes to say that.
Thank you. Thank you, Razia. I'll be very succinct, I'm sure, because I'm the last panelist. Am I audible?
Yes, please.
Yeah, thank you, because I'm in fields, I'm not sure about the network. So thank you very much. I'm grateful to STPI and really feeling privileged to be part of such august and galaxy of women in Pakistan. I'm really, really happy to be part of this thing. So, during my pursuing career for a manager for health, I actually read an article that helped me a lot. And I just would like to share what was that. So it was Thomas' article on women in leadership. And that's a professor of business psychology. So there were 3 popular, explanations under the representation of women in management. Number 1, the thing is that either they are not capable, number 2, or they are not interested. And third, maybe they are interested, capable, but they are unable to break all those glass ceiling, which my worthy panelists have already highlighted, all those invisible career related barriers that has stereotyping, gender biases that actually preventing women like us for accessing to a certain rank of power and managerial post. So in a nutshell, absence of women in the leadership role, has less to do with us, women ourselves, but it's more to do with how we interpret the leadership. There are certain traits, there are myths, there are concepts, and that has been taken as a mislead for, the triad of leadership. For example, confidence is a trait that is more associated with certain gender. I won't take the name of gender, but it is often misinterpreted with the competency. So I feel I'm lucky that I'm working with UN system. And why I'm saying that, because then there are certain enabling environment, Razia, you've already highlighted. The working with the organization who have highest core value, principle, policies, gender inclusive, gender equity, equal opportunity for both, is irrespective of gender, safe and prosperous working environment, acceptance culturally and norms that are, in that organization are very much favorable for women to speak, to show their leadership skill. There are opportunities of learning. We've learned a lot through leadership building courses. For instance, within UN, we have a Leadership Women in UN program that actually promote the expansion and renewal of all those models of leadership that globally, regionally, women are cherishing. So such kind of gender balanced workplace, actually are the added advantage for women like us to explore our leadership skill and to contribute at the managerial level to the health system. Now, the question which you just asked, because I have to be very succinct at the barriers, which I face as personally to make decision making despite having, director level position at UN. What are those? So see, I belong to a high value STEAM organization where I've got the opportunity to exercise all those skills and competencies. However, we have to move in an environment. So then there are systemic barriers, which are invisible to whom we are interacting. These certain norms, the safety and security issues, Dr. Saib have already highlighted, the access to a certain gender to talk about certain difficult topics. And then there are certain cultural barriers in our country. So all those things, above and all, certain mindsets, seeing women on the leadership role, these are those barriers and challenges which sometimes does not allow us to cherish our position the way we would like to, or maybe our other counterparts are enjoying. Now, the third part of your question, that what could be the promoters, I still believe that, working for women, it would be the women who will be, taking this lead as a move, as a movement. And I can see that, through such kind of effort, the webinar and more to come would provide us an opportunity. I believe that the system response, enabling environment for working women is the key, the promoter for women to exercise their own skills, confidence, and experience. Because women by default are meant for nurturing care, though it should be parents' responsibility, but so far we are exercising, women-oriented nurturing practices for our children or our household. So that's where I see the change should come, which allow or enable women to experience more managerial role. Second, whatever the organization is, public, private, corporate sectors, organization, maybe it's something which is driven through government legislation or policies to allow organization to set SOP, to practice, to provide such high value, principles, which we being in UN system is experiencing, maybe can replicate it and enjoy the equal opportunity and all those principles. Plus, then there are need to understand the cultural, socio-economic acceptance. What we need to do, probably we need to have a social behavior change campaign, maybe an advocacy to those whom we probably not reach yet and we need to reach. And then there are individual promoters as well. You've asked about the promotion. I believe that the confidence, all those virtues, the competency itself, and the knowledge which we are obviously possessing, all those are the promoters and contributors, for a women to actually access and enjoy the managerialship. And as we've already highlighted, my colleagues, my panelists have already shared that you will find women in the health system, but why only at the low level? Why not at the managerial level? I think this is a time we need to think about it and to have a comprehensive analysis at each level to identify barriers, enablers, and then through that, probably together we all can have an advocacy and policy paper that how we can move together to enhance women in the leadership role in this country. I hope I observe the given time period, Razia. Thank you.
Dr. Sabah Shahzad, for taking your time. You were busy, but you could manage. Okay, thank you. Thank you. In the end, I will like to mention one thing about the Ministry of Health washroom, which was made by JSI. It was very like a popular place, but it was difficult to describe it. So in so many words. So thank you very much, Dr. Shazia, for your concluding remarks. We would ask you for your conclude this session. We had wonderful discussion, and I hope you are online. And we understand that you were busy in session. So over to you for concluding remarks. Thank you. And your point on this for women leadership, she is one of the role model where we can look forward to her, that she is a doctor as well as a leader in decision making. Thank you.
Rahim. Thank you. Thank you, SDPI, Dr. Suleri and Dr. Razia. Assalamu alaikum to all. First of all, I'm honored to speak to you today on this special day, World Health Day. Important theme of women leadership in health towards achieving health for all. As female parliamentarian of Pakistan, I am deeply committed to promoting the health and well-being of our citizens, especially women and girls, who face unique challenges in accessing quality health care. As we celebrate World Health Day, let's remember that health is not just the absence of disease, but state of the completely physical and mental and social well-being. Achieving health for all require involvement of stakeholders in Pakistan. As Dr. Shabnam mentioned that lady health workers, and Dr. Nabila also mentioned this, I want to say that I was a president of Pakistan Nursing Council. There is so many challenges for the nurses because of fake institutions. I mentioned the institutions are not registered with Pakistan Nursing Council, but they produce lady health worker unskilled, lady health workers, unskilled nurses, and these challenges are also we are facing. According to World Health Organization, women make up 70% of the global health workforce, including nurses, midwives, and community health workers. Women are also primary caregivers in families and communities, making them essential partners in community health programs. मैं समझती हूँ कि जो अभी SDPI ने ये चीजें एक important topic पे बात करने का सबको मौका दिया है, तो I'm a decision maker, I'm a policy maker, but I think के जनरल निगार और जितने भी participants बैठे हुए हैं, मैं समझती हूँ पैनलिस्ट बैठे हुए हैं, they are also leader. और ये हमारे लिए सब लोग रोल मॉडल्स हैं, चाहे डॉक्टर सबा हो, डॉक्टर शबनम हो, डॉक्टर रजिया हो, क्योंकि यही हैं जो हमें आगे रास्ता दिखाती हैं. We are with you because we are a decision maker, we are policy maker. I think these challenges we must invest in women's leadership in health. Here's some key areas where women's leadership can make a difference. I think women in Pakistan face many barriers to accessing quality healthcare, including social, cultural norms, financial constraints, and limited availability of health services, remote areas. As female parliamentarian who are voice for women fellows in the power corridors, we advocate for policies and programs that promote women to access healthcare, including expanding health facilities, services in rural and remote areas, and providing financial assistance for families who cannot afford healthcare. Dr. Ali ने भी बात की, Dr. Nabila ने कि जब वो कैंप्स में जाके उन्होंने काम किया था तो बहुत सारे प्रॉब्लम्स को उन्होंने फेस किया था. इस अभी जो फ्लड आया था उसमें हमने भी जब काम किया कैंप्स में तो यही सेम प्रॉब्लम्स हमें फेस करने को मिली थी. और मैं समझती हूँ कि वो रिमोट एरियाज जहाँ पे हम इन चीजों को एड्रेस नहीं कर पाते थे, हमने वहाँ पे अपने जो टेंट सिटी बनाए थे या जो स्कूल्स में हमने कैंप्स लगाए थे, उनमें ये चीजें बहुत ज्यादा मेंशन की थी कि हमारी जो वहाँ पे फीमेल्स हैं उनको प्रायोरिटी पे रखा जाए, उनके लिए एक सेपरेट कोई भी सिस्टम हो, चाहे वो वॉशरूम्स का हो या कोई और उनके जैसे कहते हैं कि सैनिटरी पैड्स के उनको पहुंचाने थे या जो भी उनके प्रॉब्लम्स थे, बीइंग अ फीमेल मैंने पर्सनली खुद जाके एड्रेस किया था, क्योंकि मैं समझती हूँ कि एज अ पार्लियामेंटेरियन, एज अ पब्लिक रिप्रेजेंटेटिव, मैं वो समझती हूँ कि हमारी पार्टी की लीडरशिप में ये है कि हम लोग ग्रास रूट पे जाके वो काम करते हैं। और मैं समझती हूँ कि आजकल हर पार्लियामेंटेरियन, हर पॉलिटिशियन जो है वो ग्रास रूट पे जाके उन लोगों को, उन चीजों को एड्रेस करना अपना फर्ज समझे कि वो जाके उनके प्रॉब्लम्स को हाईलाइट करे। इफ वी आर सिटिंग हियर, वी आर पब्लिक रिप्रेजेंटेटिव, और उनको हम रिप्रेजेंट करेंगे। जब तक हम उनके इश्यूज को हाईलाइट नहीं करेंगे, मैं समझती हूँ कि हमें यहाँ बैठने का कोई भी राइट नहीं बनता है। तो ये चीजें जब हम बात करते हैं तो बीइंग अ वुमेन, मुझे लगता है कि इन चीजों को बहुत ज्यादा बात करनी चाहिए। आपको पता है कि अभी डॉक्टर साहिबा ने बात की कि मदर, मैं समझती हूँ कि सिर्फ एक मदर ही होती है जो एक वुमेन लीडरशिप हो या एक मेल लीडरशिप हो, जिनको वो प्रमोट करती हैं। मर्दों की सपोर्ट हमें चाहिए, मर्दों के माइंडसेट को चेंज करना जरूरी है, क्योंकि चाहे मैं पार्लियामेंटेरियन हूँ, जनरल निगार और बाकी सब लोग अपने अपने फील्ड में, उनको पता है कि किस तरह से अपने आप को मनवाना पड़ता है। आप कितने भी कॉन्फिडेंट हो, आप कितने भी एक्सपीरियंस्ड हो, आपको अपनी स्पेस किस तरह से बनानी होती है, अपने आप को किस तरह से उस सेटअप में सेट करना होता है, लोगों के माइंडसेट को समझते हुए उस जगह पे आना होता है। तो मैं समझती हूँ कि चीजें बहुत अभी टाइम लगेगा जब हम लोगों को ये चीजें समझा सकें, लेकिन इस तरह के अगर वेबिनार, इसी तरह के अगर प्रोग्राम्स होते रहे तो मैं समझती हूँ कि बहुत जल्द जो हमें बहुत दूर चीजें नजर आती हैं वो हम बहुत जल्द कर लेंगे। अभी लास्ट मंथ में जो एक वुमेन मार्च के नाम से एक चीज हुई थी, मैं समझती हूँ कि हम अपने राइट्स के लिए एक गलत रास्ता चुन रहे हैं। हम अपने आप को, अपनी जो कैपेबिलिटीज हैं उनको अपने सामने ला के अपनी चीजों को मनवाना चाहिए। ये मैं समझती हूँ कि ना सिर्फ मेडिसिन में, एजुकेशन में, चाहे आप पीएचडी पे लेवल पे चले जाएं, डॉक्टर्स हो, कोई भी हो, लेकिन जब वो एक अच्छी जगह पे आते हैं, एक रोल मॉडल बनते हैं, तो मेरे ख्याल में सभी उनको फॉलो करते हैं। और एम्पावरमेंट की ये चीजें हैं कि women play a critical role in providing healthcare in Pakistan, particularly in rural and undeserved areas. Empowering women to take on leadership roles in health sector can ensure that their voices are heard and their contributions to healthcare recognized. Women leaders in the healthcare sector can help address gender disparities and healthcare in Pakistan. They can ensure the women have access to the same quality of care as men, and their unique health needs are addressed, particularly in maternal and child health. Women leaders in health sector can be powerful advocates for women health issues in Pakistan. They can push for policies, programs that promote women's health and well-being, such as access to reproductive health, maternal health, child health services, and gender-based violence prevention and response. I think SDPI अगर इसी तरह से या कोई भी और ऑर्गेनाइजेशन इसी तरह से ही कनेक्टेड रहते हैं और अपनी कोऑर्डिनेशन रखते हैं टिल ग्रास रूट तक, तो मैं समझती हूँ कि हम वुमेन एम्पावरमेंट और जितने भी पॉलिसीज मेकर्स हैं उनको हम ऑन बोर्ड कर सकते हैं, वन पेज पे ला सकते हैं, और एक अच्छी वुमेन एम्पावरमेंट इन हेल्थ हो या वुमेन एम्पावरमेंट इन पाकिस्तान एट एवरीवेयर, तो मैं समझती हूँ कि ये चीजें हम कंट्रीब्यूशन दे के ही कर सकते हैं। और मिनिस्ट्री ऑफ हेल्थ इज ऑलवेज विद यू। जब भी कोई ऐसी बात होती है, आई डोंट थिंक सो कि मैंने कभी आप लोगों को मना किया हो या कभी किसी चीज पे ना की हो कि नहीं मैं नहीं कर सकती या टाइम नहीं है। अभी भी सेशन ऑन गोइंग था, लेकिन मैंने एक रिक्वेस्ट की कि मुझे किसी का ऑफिस दे दें जो असेंबली के अंदर ही हो, मैं सिर्फ एक प्रोग्राम अटेंड कर लूं। तो ये चीजें आपको आगे लाने के लिए, आपके चीजों को प्रमोट करने के लिए, वुमेन एम्पावरमेंट के लिए मैं समझती हूँ कि बहुत अच्छी हैं। और इसी तरह के प्रोग्राम अगर हम करते रहे तो मैं समझती हूँ कि जो एक बात हुई थी डॉक्टर ब्राइट की, मेरी सिस्टर कार्डियोलॉजिस्ट है और वो घर भी मैनेज करती हैं, अपने पेशेंट्स को भी मैनेज करती हैं। और बीइंग मैं सिर्फ नाम की डॉक्टर अब रह गई हूँ, लेकिन बिफोर गोइंग टू पॉलिटिक्स मैं एक गायनाकोलॉजिस्ट थी और अच्छी तरह से सर्व करती थी। लेकिन आपको पता है कि गायनाकोलॉजिस्ट 24/7 सर्विस है, तो मैं अपने पेशेंट्स के साथ वो चीज नहीं करना चाहती थी जो बाकी सब लोगों के साथ होती है। तो मैंने उनसे रिक्वेस्ट करके उन सब पेशेंट्स को दूसरे डॉक्टर्स के पास भेजा और मैंने कहा कि एक ही जगह पे अगर मैं डेडिकेशन अपनी दे सकती हूँ सिंसियरली तो मैं पॉलिटिक्स में दे दूं। लेकिन अभी भी उन पेशेंट्स की कॉल आती है कि डॉक्टर साहब अब कब वापस आएंगी। तो मैं समझती हूँ कि ये हमारी सर्विसेज ही हैं कि हम लोग अपने लोगों का ख्याल करते हैं। और अभी वॉशरूम्स की बात हो रही थी, तो मैं क्योंकि सखर से हूँ तो वहां पे हमने ये चीजें एक ऑर्गेनाइजेशन के साथ मिलकर शुरू की हैं कि हमने वहां पे वुमेन की हिरासमेंट कमेटीज बनाई हैं और हर एक जो भी इदारा है, जो इंस्टीट्यूशन है, वहां पे हमने लेडीज वॉशरूम का अलग से उनके बनवाए हैं ताकि ये प्रॉब्लम जो हमेशा सबको फेस करनी पड़ती है वो ना हो। और यही चीज हमने अपने असेंबली में भी की है कि लेडीज का वॉशरूम हमने सेपरेट किया है, एक लेडीज लाउंज हमने अलग बनाया है जहाँ पे लेडीज जो वुमेन पार्लियामेंटेरियंस हैं वो जाके थोड़ा सा रिलैक्स कर सकें। तो आई थिंक हेड्स ऑफ टू SDPI एंड ऑल पैनलिस्ट कि आप लोगों ने इतने अच्छे टॉपिक पे इतने अच्छे रिमार्क्स दिए, इतना अच्छा फीडबैक दिया। और मैं एक दफा फिर डॉक्टर राजिया और डॉक्टर सुलेरी साहब को ये थैंक यू करूंगी कि आपने ये एक वक्त जरूरत समझा इस चीज को कि इस चीज को भी हाईलाइट होना चाहिए। तो बहुत शुक्रिया आप लोगों का। और नेक्स्ट मैं समझती हूँ कि किसी और अच्छे टॉपिक पे हम सब एक दफा फिर इकट्ठे होंगे। थैंक यू ऑल, थैंक यू सो मच।
Thank you very much, Madam, for your insights and for your kindness always for offering us. Actually, it's because of Juma we could not take many comments or many question answer session. So it was a long program. So we have our esteemed Dr. Nabia Tarek, who has worked in Shifa Hospital for 20 years, and she has many of them. And we could not actually touch the pay gaps and most the problems of most of the frontline workers, and as well as the quota system. Because in the coming generation, I think I was looking at the DMG like officers. In 2022, there was more than 50% of the females. So I am looking forward, like in future, we may see at least 50-50 female leadership in medicine as well, in healthcare as well. So thank you very much for all panelists and for all esteemed guests, and thank you very much for listening to us. And I think we will bring out some good recommendations, and they will be shared with you and and thank you, Dr. Sobia, again for your offer, and we will definitely keep you in touch. Thank you. Thank you very much.
Thank you.
Thank you.
Thank you. I would like to add one thing.
Yeah, please.
You have highlighted all the issues and all the problems, but your recommendations must include what are the solutions. How we are going to end this gender bias, because the problem starts, the men ego and men thing is there. If we are two people of the same caliber, the man has its ego and
they have the glass elevator, my soul. They have the glass elevator.
The problem starts from the home. The grandmother, the mother, they brought up them from the very early childhood. There is a difference in the brought up. We have to end this discrimination from their birth. And these are the women who are playing the role of treating them differently from the daughters.
That's what I
rightly said. And let's make a group by which we can just thank you very much. Servants.
So take care of the house.
Thank you.
Madam, you put us.